A patient's ECG suddenly shows low-voltage QRS complexes in all limb and chest leads. What is the most likely technical cause? A. Loose RA and LA electrodes. B. Incorrect paper speed. C. Reverse limb lead placement. D. Patient hyperventilation. Answer A. Loose limb electrodes reduce signal amplitude globally. This produces uniformly low voltage QRS complexes across all leads without affecting waveform shape. A right ventricular infarction may be suspected when the ECG shows inferior MI changes plus which additional finding? A. ST elevation in V1 greater than V3. B. ST depression in AVR. C. T-wave inversion only in V6. D. PR segment elevation in V2. Answer A. ST elevation in V1 greater than V3 strongly indicates right-sided involvement. This pattern results from injury currents directed posterior to anterior. A treadmill stress test is terminated early when the patient develops bigeminy PVCs. What is the priority action? A. Reposition chest leads. B. Apply oxygen immediately. C. Stop the test and monitor rhythm. D. Increase treadmill grade. Answer C. Bigeminy during exertion suggests myocardial irritability requiring immediate cessation. Continued exercise could precipitate sustained arrhythmias. Which finding most suggests atrial flutter with variable conduction? A. Sawtooth waves with inconsistent RR intervals. B. P waves hidden inside QRS. C. Wide QRS with fusion beats. D. P waves more prominent during deep breathing. Answer A. Flutter waves remain constant but ventricular response varies, producing irregular RR. This is characteristic of variable AV block. Misplacement of V1 and V2 too high on the chest can mimic which condition? A. Septal MI. B. Hyperkalemia. C. Atrial fibrillation. D. Left atrial enlargement. Answer A. High placement produces pseudoseptal Q waves resembling infarction. Correct level is the fourth intercostal space. ST elevation in lead AVR greater than all other leads suggests what emergent condition? A. Left ventricular hypertrophy. B. Left main coronary artery occlusion. C. Mild pericarditis. D. Digitalis toxicity. Answer B. Dominant ST elevation in AVR with widespread depression is a hallmark of LMCA obstruction. It indicates global subendocardial ischemia. What is the best indicator that a stress test reached adequate diagnostic value? A. Patient reported mild dizziness. B. Achieved 30% of predicted max HR. C. Achieved 85% of H predicted max HR. D. Test lasted at least 8 minutes. Answer C. Reaching greater than or equal to 85% of predicted HR ensures adequate cardiac workload to detect ischemia. Duration alone is not diagnostic. Which electrolyte imbalance most increases risk for torsades de pointes? A. Hypercalcemia. B. Hypomagnesemia. C. Hypernatremia. D. Hyperchloremia. Answer B. Low magnesium prolongs repolarization and delays QT, creating conditions for polymorphic VT. It also worsens concurrent hypokalemia. A wandering baseline appears intermittently. Which cause is most likely? A. Broken ECG cable. B. Improper ground lead contact. C. Patient shivering. D. High AC interference. Answer C. Muscle tremors create low-frequency oscillations that distort the baseline. Securing warmth helps stabilize recordings. What ECG change is most characteristic of acute pericarditis? A. Diffuse ST elevation with PR depression. B. ST elevation limited to V1, V3. C. Large Q waves. D. Bifid P waves. Answer A. Pericarditis causes widespread ST elevation with PR segment depression from atrial inflammation. It lacks reciprocal depression. A patient has a regular rhythm at 150 bpm with narrow complexes. Which rhythm is most likely? A. Atrial flutter with 2:1 conduction. B. Sinus tachycardia. C. Ventricular tachycardia. D. Idioventricular rhythm. Answer A. Flutter at 300 bpm with 2:1 block produces a ventricular rate near 150. Narrow complexes confirm supraventricular origin. After relocating an electrode, artifact disappears in multiple leads. What does this confirm? A. Machine malfunction. B. Electrode adhesive failure. C. Patient skin temperature too low. D. Incorrect paper calibration. Answer B. Poor adhesion affects multiple leads sharing that electrode. Replacement eliminates movement-induced artifact. A sudden extremely tall T wave in V3 suggests which urgent metabolic disturbance? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hyponatremia. Answer B. Tall, peaked T waves reflect accelerated repolarization due to high serum potassium. This precedes QRS widening. Which leads represent the high lateral wall of the LV? A. V2 and V3. B. I and AVL. C. 3 and AVF. D. V1 and V6. Answer B. Leads I and AVL monitor electrical activity of the high lateral myocardium supplied mainly by the circumflex artery. A patient demonstrates second-degree Mobitz 2 block. What is the key feature? A. Gradual PR lengthening. B. Dropped QRS without PR changes. C. P waves absent. D. Prolonged QD intervals. Answer B. Mobitz 2 produces sudden non-conducted P waves with stable PR intervals. It indicates His-Purkinje dysfunction. Failure to remove lotion before electrode placement most likely causes what artifact? A. Alternating current interference. B. High-frequency jitter. C. Poor tracing with drift. D. None, lotion doesn't affect readings. Answer C. Lotion blocks proper conductivity and causes a drifting baseline from inconsistent skin contact. Which ECG feature suggests pacemaker non-capture? A. Pacing spikes followed by wide QRS. B. Pacing spikes with no ensuing complex. C. No pacing spikes visible. D. Irregular spikes of varying height. Answer B. A pacing spike without electrical response means the myocardium failed to depolarize. This requires immediate evaluation. A patient with COPD shows a vertical P wave axis. Which change is expected? A. Tall P waves in lead 2. B. Inverted P waves in lead 3. C. Peaked P waves in AVL. D. Decreased amplitude in V4. Answer A. COPD shifts the heart vertically, increasing right atrial loading and causing tall P waves, P pulmonal. To correctly measure QD interval, which rule is most accurate? A. Measure from P wave start to T wave end. B. Measure from QRS start to T wave end. C. Measure only T wave peak. D. Measure the widest QRS portion. Answer B. QT covers entire depolarization and repolarization, beginning at QRS onset and ending at the T-wave termination. A notched or wave in V5 and V6 may indicate which condition? A. Right bundle branch block. B. Left bundle branch block. C. Sinus block. D. Ventricular escape rhythm. Answer, B. LBBB produces broad notched or waves in lateral leads due to delayed LV conduction.